works. And we are pleased to have some great folks in the studio right now. And I want to go to Chanda Johnson, U.S. Army veteran, and Jesse Brown, Public Affairs Officer, with over 18 years of combined VA experience. Chandra, how are you?
Hello, Mr. Kelly. How are you today?
Good. I'm Cliff.
Oh, hello, Cliff. How are you today?
How you doing today? Important topic. We always have important topics, so we've got some folks here. Get us together. We've got the great subject and some great ladies in the studio.
Okay, so today I have with me Jenny Sitzer. She's the Women Veterans Program Manager at Jesse Brown, and I also have Misa Lopez. She is the Intimate Partner Violence Assistance Program Coordinator at Jesse Brown, and they're here to talk about their programs today. So we're going to talk about women's health, and we're also going to talk about the Intimate Partner Violence Assistance Program. So I'll go ahead and kick it over to Jenny so she could start talking about what we do for women's veterans.
Good. Jenny, hi.
Hi.
Hi, Jenny. How you doing?
I'm good. Thank you for having me here today.
It's a pleasure.
First and foremost, I just wanted to say a few words about my role. I serve as the facility advocate for women veterans, both women veterans seen for care at Jesse Brown VA, but also women veterans that live in the Chicagoland area that may not be connected to the VA. I'm their point of contact at the hospital if they have questions about benefits, healthcare services, or resources in the community. Also, I'm here representing the Women Veterans Health Center at Jesse Brown. We have a comprehensive women's health center with primary care providers, women's health specialists, also gynecologists, clinical pharmacists, social workers, nurses, also many mental health care providers, 2 psychologists and a psychiatrist. So I think the most important thing I can say is that we have women's health services at Jesse Brown. Mm-hmm. They're all in one location, and we have open access, especially to mental health care. Women vets can see a psychologist same day they come in.
Wow. That's what, Jenny, who would be coming there? What would be the situation where women vets would want to come to see you?
Well, we see women across their lifespan for a whole variety of healthcare and mental health care issues. Most women coming into the VA are actually seeking care for both mental health and medical care. So some of the more common presenting issues are common chronic health conditions such as heart disease, diabetes, but also musculoskeletal conditions often related to their time of service. Also depression, anxiety, certainly PTSD. But also a lot of people don't know this, but the VA has a very broad range of benefits they provide, and that includes maternity care. The VA covers maternity care. Also infertility evaluation and treatment, which is a big concern for many women veterans. Mammography, so preventative health screening is also covered. Many transgender healthcare services are covered. So these are things that people often don't associate with the VA, but these are covered services, and we do provide them.
Be easy to say what you don't cover.
Right.
Yeah, that's good. That means a lot particularly when you talk about maternity care and all. You know.
The mammography is a big selling point as well.
Yeah, absolutely.
And having had a child myself not all that long ago, I can say
right? Okay.
I can say that I think that women veterans really receive the highest quality care because they actually get connected to an obstetrician of their choice in the community, and the VA pays for the care.
Oh, great.
But then we have a nurse in the clinic who maintains contact with veterans throughout their pregnancy and during the postpartum period to make sure they have everything they need, from a breast pump to mental health services if they have any concerns about postpartum depression, baby care supplies, diapers, etc. So to have that kind of really intensive support during that time period when, it can be stressful, I think that's an important thing.
It certainly can't be stressful. Now, do you have to be married, or are you just a veteran? What's the requirement?
As long as you are VA healthcare eligible,
Okay. Meaning
that's
you're a
all that
veteran.
matters.
Uh-huh.
As long as you're a veteran and you're eligible for care at the VA, you can get maternity care benefits.
I wonder how many people know that.
Yeah, no. And here's a question that I had actually. Do you have the choice to go to Women's Health, or if you wanted to just go to a regular primary care provider in the VA, do you have that choice?
Yes, you always have the choice.
Okay.
We encourage women veterans that are new to the VA system to see what we call a designated women's health provider, meaning that primary care provider has met specific proficiency standards in women's health care. So we want women veterans to see those providers, but if they feel more comfortable in another clinic outside of the women's clinic, they're free to see those providers as well.
Okay, thank
great.
you. And I'm going to go ahead. I wanted to give Misa the floor so she could talk about her program, which I need to learn a lot about. So I'll turn it over to Misa.
Sure. Thank you so much. And thank you so much for having me here to talk about this program, because it is a very important program. Although the VA has been researching and evaluating and supporting the very important topic of intimate partner violence or domestic violence, it has been about as recent as the last couple years, in 2019, January, where a directive was signed that all VAs should have an intimate partner violence assistance program. And what that means is having a program in place to support veterans, male and female, non-veteran partners, and staff members who may be experiencing violence. I think important to know is generally when we think about intimate partner violence, immediately the thought is physical violence, but it's important to know that it can be verbal, emotional, psychological, there can be financial abuse. So I think we're trying very hard to change our language and be more person-centered. So we don't use terms like an abuser or a victim. We use terms such as someone who's experiencing violence or someone who's using violence, because that invites us into the conversation, because we'd like to work with folks to allow for safety, provide support, and to help people understand and relate to one another in more healthy ways and to have healthier relationships.
Interesting. Does that also accommodate problems where the person that's being abused is a male?
Sure, that's a great question.
Yeah, because that happens.
Absolutely. And I'm glad you brought that up, because I do think that there can be a lot of stigma around males being involved in intimate partner violent relationships. I do work with a number of veterans who are male who have disclosed that their relationships have been unsafe. And interestingly, when I speak with them about their relationships, the level of danger seems to be exponentially greater, at least in my experience with the individuals that I've worked with. And it's very difficult for them at times to understand that they're even in a violent relationship, because the thought is when we're talking about healthy relationships and safety and being entitled to mutually respectful and collaborative relationships, that they don't see it so much if their partner is yelling at them or demeaning them or putting them down or hurting them as intimate partner violence. They just will respond in ways to say, oh, well, she's crazy or he's crazy. and not really identifying that this is a really unhealthy situation and potentially very unsafe.
Absolutely. Our call-in number is 312-374-8130. I would presume in this situation, Chandra, that in many instances the folks have problems like this, but they don't want to talk about it.
That is true.
Is that correct?
That is true.
Mhm.
So, Misa, what are the qualifications of this? You have to be a veteran. So, do you treat the veteran and their spouse, both sides, or?
Sure. So the thing that I love about this program is we're all encompassing. I work with veterans, non-veteran partners,
Great.
staff. To be perfectly honest, IPV and anti-violence is very important to me. So if somebody walked in and walked up to me off the street, I would help them and give them resources. But the reason being is we work very hard to build internal collaboration. So an individual who is a veteran, who is either using or experiencing violence, if they're eligible for VA healthcare services, we can provide linkage to services internally. There are some services that we don't provide, such as emergency shelter if somebody needed to be safe, or legal advocacy if somebody needed to get an order of protection or go through that process. So another component of this program is we work very hard to build community partnerships with agencies who can support various aspects of moving through a relationship that would be unsafe. So we partner with agencies who can provide emergency shelter, children's services, mental health services for people who are not veterans, so if it's a non-veteran partner, also legal advocacy. So we couldn't do half of what we do without our community partners. So they're very, very important to us. And it allows us on another level to help them understand the veteran-centric needs, because there are some very specific needs veterans have in these types of relationships. A lot of their life experiences and their military experiences lend to some of the behaviors. And so we help them understand that there's very complex needs. And in the same token, they lend their expertise to us if there are situations that we might not be the expert in.
There's a lot there. Chandra, we got a couple of seconds.
Okay.
Well, a couple
If
of
you
minutes,
could
I should
please
say.
give your contact information, Misa,
Right.
if somebody's interested in the program, and Jenny, you too, but Misa first.
Absolutely. So more globally, if one were to go to www.va.gov, type IPV in the search bar, and that will take you to the VA social work IPV page. At Jessie Brown, I can be reached directly at 312-569-8603. And for anyone in the community, veteran or non-veteran, to have the National Domestic Violence Hotline number would be very important. They provide 24-hour assistance, safety planning, resources, crisis intervention for anyone who is involved in an intimate partner violent relationship. Their number is 1-800-799-SAFE.
Great.
And if any woman veteran has questions about VA services, the best way to get information is to call the National Women Veterans Call Center, and that number is 1-855-VA-WOMEN. And that by calling that number, you get connected to whoever's in my position at the VA hospital closest to where you live.
This is great. Yeah, I think I'm sure, Chandra, a lot of folks, which is why we do this, don't have a clue that you can get all of this great information.
That is true.
You
And
know-
I am a female veteran. I've been receiving my care for the longest time, since 2001. So I have no complaints about the service. I love it. I actually choose VA over the private sector anytime.
That's
Yeah.
great to hear, isn't it? Very good. Ladies, thank you so much for being here.
Thank you so much.
Certainly
Thank you.
appreciate it.